GWM is embarking on an international missions trip to East Africa and Southern Africa in 2022. The missions trip shall include the hosting of the Intermission Mission Conference, the School of Ministry, the Medical Mission, and the Clean Water Borehole Project. The programs are scheduled to be hosted in the city of Kitwe in Zambia and the city of Nairobi in Kenya. In these international mission conferences, Global Wisdom Missions will bring together thousands of pastors, leaders, and ministers of the gospel from both regions to train them in a 5-day school of ministry in the Ministers Training Seminar. Global Wisdom Missions has the vision of reaching out to young Christian leaders, ministers, and pastors with the purpose of preserving the purity and integrity of the gospel of our Lord Jesus Christ. The mission to East and Southern Africa in 2022 will be critical because it will be the first of its kind since GWM was founded in June 2020. Following the pattern of our Lord Jesus Christ of preaching, teaching, and healing, Global Wisdom Missions will undertake additional socially responsive programs to bring healing and hope to the communities struggling with poverty, sicknesses, and diseases. Considering this, GWM will travel with medical doctors and health officials from the United States of America, USA, United Kingdom, UK, and Europe, who will volunteer to offer free treatments to thousands of sick people in both regions. Additionally, the GWM will construct a clean water borehole for the selected villages in both regions where they do not have access to clean water. In view of the above projects, the Global Wisdom Missions GWM is asking for your financial support and donation to make these missions and projects a possibility. Find a place in your heart to give your financial and material support to this international mission and charitable projects. Your donations will lighten our burden and make our work possible. We remain eternally grateful for your ongoing support. To donate, please visit www.globalwisdommissions.com or donate via PayPal at wisdomconference3@gmail.com. Thank you.
And his health. We talked about high blood pressure. We talked about diabetes. We talked about weight management, and we talked about knowing your numbers. And today we are going to, have a very important discussion, and we have very important and experienced people on the panel, and I'm going to hand over to Maud to introduce our panelists.
So good evening, our viewers. Thank you once again for joining us for tonight's edition of the Wisdom Conference. And like Dr. Jonathan Layu rightly said, we'll be looking at preventive health tonight. And I'm going to just ask my lovely ladies to introduce themselves first. I'm going to start with Dr. Patience Annan. Dr. Patience Annan, could you please introduce yourself?
Hi, so I'm Dr. Patience Annan. I'm a medical doctor in the United Kingdom. I specialize in general medicine, and I also have my own private practice here in Hampshire. Thank you.
Thank you. Dr. Ali, can you please introduce yourself to us?
Yeah, hi, my name is Dr. Ali Obe Eremolo, a primary care physician in the United States here. So basically in the UK, that would be a general practitioner, and I currently reside in Little Rock, Arkansas.
Thank you. And Dr. Jonathan Laye, could you please introduce yourself to us?
So I'm Dr. Jonathan Laye. I'm a colorectal surgeon, and I'm a professor at the University of Arkansas for Medical Sciences in Little Rock, Arkansas. Thank you.
Thank you. We seem to have lost Dr. Kate Forbes, but I believe she'll be joining us very soon. She was on, but I believe she'll be joining us. We are just going to get started. Dr. Jonathan Lai, could you please give us introduction to the topic? Oh, yeah. Should we just wait for Dr. Kate Forbes?
Yes.
Hello.
Yeah. Hi.
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 I'm sorry, I had to change computers. Mine just suddenly went very silent.
Oh dear. Glad it happened before the program.
Yes. Yeah.
Dr. Kate Forbes, could you please like to introduce yourself to us?
Okay. I am a GP. I live in Southampton. I'm married to Andrew. I'm using his computer, as you can tell. I don't know what else to say, really.
She's a lovely woman of God.
Thank you, Maud.
Okay, so now that we know that we are in able hands, I'm going to just hand on to Dr. Jonathan Lai, and I'm going to ask him why this topic. So, Dr. Lai, why preventive health?
So we talk about the saying that an ounce of prevention is worth a pound of cure. So you know, when we look at our healthcare system, you know, a lot of it is geared towards treating illnesses and diseases. So that is people who already have diseases. But an important aspect of health is making sure that we are healthy. And I will use the analogy of, you know, when you have a car, you know, you take the car for checkup, for oil change, you make sure that, you know, the brake fluid, you know, level is okay. So we do frequent checkups to make sure that our car is running well, so that we don't, you know, get left by the wayside, you know, on the way to work or on the way to important appointments. And so it is with our health. There are things that are important that help us to keep our body in shape. And as we talked about, you know, the last time, the Bible says that our bodies are the temples of the Holy Spirit. And in fact, you know, in Second Corinthians, Paul was even saying, if we destroy the body, which is the temple, you know, God will destroy us. I mean, so God has given us this body as his vehicle, as his temple, you know, as his dwelling place. And we need to keep our bodies healthy. And so preventive health talks about, you know, things that we do to prevent us from getting diseases and illnesses, so we stay healthy. And so that's kind of how I will describe preventive health. Now, why is it important? It's very important because, again, as we said, our bodies are the temple of the Holy Spirit, and we need to be healthy. I mean, again, the last time I gave a quote that a healthy mind in a healthy body, right? So we need our bodies to be healthy. A very popular scripture that we quote, you know, when we talk about prosperity is, you know, where in, you know, 3rd John, it says, beloved, I wish above all things that you may prosper and be in health, even as your soul prospers. So God wants us to be in health. The last time we quoted several scriptures, you know, indicating that God is interested in us being healthy. And an important part of being healthy is to think of preventive health, you know, having a maintenance kind of a healthy body as something that's very important, because if you are ill, first of all, that does not glorify God per se. I mean, unless if you get healed, and you will not be able to fulfill your assignment if you are ill, or if you are, you know, infirmed, one way or the other. So that is why this is very important. And I think the topics that we are going to discuss today are very germane and very important when we talk about preventive health.
Thank you, Dr. Jonathan Lai. And to be honest, I don't think we could have come up with any much better topics than you did. Considering the passing away of Chadwick Boseman just yesterday, and I was just thinking, well, coincidentally, we had our topics before then, but it makes it all so relevant even now. And this evening, our aim is to be covering breast cancer, cervical cancer, and colorectal cancer. And we'll be looking at the symptoms, the causes, the diagnosis, treatment, living with, and as well as prevention. There'll also be time for questions and answers, and we will end with a prayer from our prophetic woman. So I'm just going to move straight into our questions. Dr. Kate Forbes, what is cancer? If we say cancer, what is cancer?
So I'll go back to one step back, and actually our body is made up of different types of cells. And each of the types of cells perform a certain function. So our skin is made up of skin cells, our gut is made up of gut cells, our heart is made up of heart cells. Essentially, each part of the body has specialized cells which help it to function, that has specific functions for that part of the body. And what happens in cancer is something in that specialty gets switched off. And instead of those cells doing what they're supposed to do in that part of the body, they go rogue. And so they stop doing what they're supposed to be doing and just do their own thing. And in that process, they multiply more of themselves, so they become like a clone of themselves, and they just function outside of their remit. So essentially, cancer is normal body cells that have gone rogue and are now basically misbehaving. So that's, in a very, very simple nutshell, what cancer is.
Thank you very much. Now, one more question, Dr. Forbes. Is cancer a death sentence? If you are diagnosed with cancer, does that mean you are going to die?
Well, we're all going to die at some point, but it's not necessarily from that particular cancer at that particular time. At some point, we will die, but actually not necessarily from the cancer. And actually, as a rule of thumb, the earlier you get it, the much easier it is to treat, and the much less likely you are to get to die from it. So that's one of the reasons why we're talking about this today, because it's good for us not to stick our head in the sand about this and think, oh, well, you know, that's it, I'm a goner anyway, because actually that's not quite how it works. And that's not quite how it is. So yes, so screening and being aware of what can happen and what can go wrong actually helps empower us to be careful with our bodies, this body that God has given us. And because some cancers can be cured, some can be treated, and that's just using worldly wisdom. I know with God's wisdom and God's power, it's even better picture. So anyway, it's not a death sentence, no.
Right. Thank you. Thank you. So that's a good place for us all to start from. Dr. Ali, I just want to find out, what is breast cancer?
Well, like Dr. Kate had just said, cancers are named based on the cells in your body that they come from. So when we talk about breast cancer, we're looking at cancers that originates from the cells in the breast. So typically you would find breast cancer in breasts. You can also find breast cancer in what we call the axilla, or in simple terms, your armpit. So those are the two common sites that you would typically, when we hear about breast cancer, that's where they originate from, cells of the breast tissue. There are different types of tissue in your breast. So any abnormal growth in those cells can cause breast cancer or even spread to the armpit, but it's still breast cancer.
Right, thank you. Could you tell us a bit about the incidence rate? Why is it important that we are talking about breast cancer tonight, especially?
So breast cancer, especially in women, is one of first, it's the leading cancer diagnosis in women worldwide. The incidence differs from place to place. So where I am in the United States, we're looking at probably in about 100,000 women. We're looking about 131% of them, or 131 are going to be diagnosed with cancer at some point in their lifetime. Now, in regards to that, breast cancer is the second leading cause of death worldwide. So that tells you kind of on the hierarchy where it is. Now, when I talk about these stats, one of the things I also want to mention is when we talk about breast cancer, most people think, oh, well, women, it's something prevalent in women, but also men can also. Now, to a very, if we're looking at it from a percentage standpoint, probably about 0.5 to 1% of men would develop breast cancer, but it is also something that men can have. So I don't want the men to tune out thinking, oh, this is a woman's thing, and I don't have to listen to this. Yes, you can also have breast cancer, however rare, in males. So it is in one of the, if we're looking at a cancer tier, breast cancer does stay at the top tier when it comes to cancer diagnosis and also cancer deaths. The first leading cause of death is lung cancer, followed by breast cancer worldwide.
Thank you very much for that information. Dr. Patience Annan, what are the symptoms of breast cancer?
Well, breast cancer has got quite a number of symptoms. The first one I'm going to talk about is the most common one that women kind of present with, which could be anything, not breast cancer necessarily, but it's breast pain. So sometimes you can come in with the pain has to be a constant pain, and it can involve all of your breast, or it can just be your nipple. Women also present with inverted nipple, which is where your nipple is actually kind of gone inside instead of including the way it normally is. We had some illustrations, some images, which I'd hope that we could project, but unfortunately we're not able to. And then the other thing as well is that you can actually have a rash around your breast area, and that can be around the areola, which is the area around the nipple, or it can be actually somewhere, anywhere around the breast where the mass is actually positioned. And that rash, it depends on your skin type. In Caucasians, it's usually quite erythematous, so it's quite red, and it looks a little bit scaly. And I believe in darker skins, it kind of has kind of like a gray, kind of ashy color. And then also you can have a change in your breast size. So women, we need to be, know our bodies. So you need to be proficient in knowing how your breasts are. I know that normally, anatomically, women, we tend to have, different size breasts. But when you see a very huge difference in the size of your breast, then you need to be worried, and you need to find out what is going on. And the thing as well is that you can notice some dimpling of the skin of the breast. Now, this dimpling looks like an orange skin. So if you look at an orange pill, the dimples that you see on an orange pill is similar to what you'd see on a breast that has cancer in it. And it's quite, it's quite obvious when you look at it, you can see. And then the common one is a lump, breast lump. You can have a lump in your breast, or you can have it in the axilla, like what Dr. Ali said. Usually a lot of women, it's when they're, having a bath, that, when they're washing their breasts, they don't feel, some kind of mass in there. And that's what usually makes them present to the doctor. Sometimes you can also have a discharge, which is coming out of your breast. This is when you know that you're not breastfeeding, or it's out of the blue. Let's say you're someone who's you've got your children are grown up, and then all of a sudden you're starting to see a discharge. And usually the discharge is like a bloody kind of discharge, or a pussy kind of discharge. If you notice those kind of things, then you definitely need to go and see your doctor.
Right, thank you very much. I'm just wondering, are there any other diseases that mimics these symptoms that you've just described?
So there are some other breast conditions which are, we call them benign, which means that they're not cancerous, but they can kind of mimic or invoke fear in women where they think that it's probably, cancer. So breast pain is a very common symptom in women. And most of the times it's because of hormones, it's hormonal. So you find that, if a woman is going on her period, you can have breast tenderness, you can have breast pain, different, times of your cycle, you can get breast pain. Also, for women that are breastfeeding, if you have things like what we call mastitis, which is basically an infection of your breast, you can get breast pain as well, and then you've got things that we call fibro, adenomas, which are basically like cysts that happen in the breast. And they can also feel and mimic, a mass. But what happens, the difference with that is that a breast cancer mass, when you feel it, usually like for us medics, when you're palpating the breast or feeling the breast, there's a different feeling that you have on the lump. So if it's a breast cancer kind of lump, it's usually quite irregular. It's not, it's quite firm, in the area where it's located. Whereas when you're talking about cysts, they can actually be, mobile. So it can be, located in different areas on your, in your breast. And so those are the kind of the common things that you can have in your breast that can make it look like, it's cancer. And when you're talking about breast discharge, some women who have issues with their glands, some of their glands, they can actually produce, some discharge that mimic, like it looks like milk, but it's not really linked to breast cancer. It's just because it's, a hormonal problem that they're having.
Thank you very much, Dr. Anand. Dr. Jonathan Lai, could you please talk us through the risk factors and the causes of breast cancer? Is it genetic? Is it from diet? Is it environmental? Could you please talk us through the causes and the risk factors, please?
So typically when we talk about cancer, it's very difficult to assign specific risks. There are a couple of cancers that are due to infections. And so, you could say, and we'll come to that when we talk about cervical cancer, for example. However, we talk about risk factors. So these are things that when people have, it makes them prone to develop, the cancer. So again, it's not a like a cause and effect, but it's a risk that is associated with developing cancer. So I just want to make that clear before people start,
Thank you very much.
get it. Yes. So, breast cancer is typically seen more commonly in older women. Okay. So kind of more typically you see it in women who are older than 50. That's not to say that young people don't get it, but the most commonly is associated with older age. Now, you asked the question, is it genetic? Yes, there are genetic changes. So changes in our genetic makeup that predispose some people to breast cancer. So the most common one that we talk about is what we call the BRCA1 and BRCA2 genes. So these are breast cancer related genes that if there are mutations in them, they predispose people to breast cancer. And in people who have these changes in the BRCA genes, it's just a matter of when, not if. They are at risk of developing cancer, and they tend to have multiple members of their families who develop breast cancer. Now, I will just interject here by saying that, a very popular actress, Angelina Jolie, for example, she made it public. She did double mastectomy, not because she had breast cancer, but because she has the BRCA mutation. So it was just a matter of when, not if. And so for her, she decided to have two breasts removed so that she would not have to deal with breast cancer. So genetic changes are risk factors. And then also reproductive history of women can be risk factors. So those who start their menstrual periods very early and then kind of get into menopause late after 55, for example. So they have a long period of time for the reproductive hormones to be working. And this tends to be a risk factor for developing breast cancer. Also, women who have dense breasts have a higher risk of developing breast cancer than those who don't have, dense breasts. Now, also, women who have had a history of breast cancer, have, for example, if someone has had breast cancer in one breast, then they have a higher risk of developing breast cancer in the other breast as well. And then I mentioned family history. So family history may be related to the BRCA gene that we talked about, or other genetic mutations that result in different types of cancers in the family. So someone who has a family history, like another member of their family with breast cancer, are at a higher risk of developing cancer, especially if the family member is a first degree relative. So when we say a first degree relative, we are talking about either a sibling or a parent or a child. And so having that, first degree relative, the risk is higher than if it's a second degree or third degree relative. Now, the other risk factor is a history of radiation. So, some cancers are treated with radiation. So sometimes if radiation has been given to the chest area where the breast is, several years down the line, that can predispose someone to developing cancer. So in general, most of the risk factors are not necessarily environmental. They are typically kind of what I would call biological, because they are related to your genetic makeup, your family history, reproductive history, the denseness of your breast, and things like that. So there are other minor risks which I don't think we need to talk about here. So again, and as I said, there's not a cause. These are not direct causes. However, these are risk factors. So it means that if you have these conditions, then your chances of developing breast cancer is higher than someone who doesn't have these conditions.
Right. Thank you very much for that thorough explanation, Dr. Jonathan Lai. So, Dr. Kate Forbes, it's such a shame we can't show your video because I actually saw it and it was really good. Now, I know it's important.
Sorry, I said just to post a link to the Facebook page and see.
Yeah.
Open it for themselves.
Right. Okay.
That's probably it's a good addition.
So Samuel, please, if you could do that for us, that would be great. If you could just copy the link that Dr. Kate Forbes shared and then just post it on Facebook, that would be amazing because she's just going to talk us through it. So it's very important that we know how to do this self-examination. Now, when I stand in front of the mirror, could you just talk us through what am I supposed to be looking out for, knowing that I'm not a medic? What am I supposed to be looking out for? Could you just talk us through it?
Can I just say just a little addition to what Dr. Jonathan said about the risk factors for breast cancer? Obesity and smoking are not helpful.
Right.
And also, what is protective is having children and breastfeeding them. And the younger you have children and the younger you breastfeed them, the more protection you have when everything else is equal. Just add that to encourage you ladies who've had children at a young age and breastfed them. Okay.
Thank you very much for that.
So
Now,
that's
can we
reflective.
talk about self-examination then, please?
Right, self-examination. So when you stand in front of the mirror,
Yeah.
you basically, as Dr. Patience was saying, you need to be able to see what your breasts look like. So the best thing to do is put your hands above your head, and so you can see the outline of your breasts.
Right.
And you want to have a look to see if they look different from each other. Most women, in fact, the vast majority, have one breast different from another. So the real function of self-examination is
Dr. Kate, can I just interrupt and ask a question? Does that mean we should be having our bras on or off at this point?
Oh, yes. Well, basically what you need to do is undress from the waist up.
Thank you.
Let's start with the basics. Undress from the waist up, and you stand in front of the mirror, put your hands above your head, and that will often show if there's any pulling or puckering or pulling up where there shouldn't be any. Look at the skin, as Dr. Patience was saying. Look at the skin. Does it look any different? Is it pulled? Is it puckering? Is it dimpled? Look at the nipples. Are they pulling in? Many women have nipples that pull in, and they were born like that, and they develop like that, and that's normal. But it's when it changes, that's always the issue. Is it changing? So one of the functions of breast examination is to look at yourself when you're absolutely fine and get used to what you look like when you're absolutely fine, because then you'll see what isn't fine. So the way that forgeries in the Bank of England are forged, banknotes are recognised in the Bank of England, is by the people looking at the banknotes just look at lots and lots of normal ones, and then they will spot when there's an abnormal one. So the function of breast examination is to know what you look like normally every day, because when you stop looking normal or things stop feel different, feel abnormal, then you know that something is different. And that's the important thing of breast examination. So
Thank you very much.
hands up, then hands on your hips. And you can also get a sense of what the shape of your breast looks like then. The best time to do it is the time around about ovulation, when you release an egg, because that's when the hormones make your breast least lumpy. And that's about 2 weeks before your period is due. So if you have a 30-day cycle, that's about 16 days after your first day of your first period. If you have a 28-day cycle, that's 14 days after your first day of your period. So right in the middle of your cycle, 14 days before your period is due. So around about then is the best time to check, because if it starts getting later in the month, you start getting lumpy anyway, in response to your hormones. As Dr. Patience was saying, those lumps there, and then they can get confusing and worrying. So least lumpy. And so that's just looking, and then you need to feel. And the best way to do it is to just use the flat of your hand, maybe in the shower or the bath. That often helps. Just with the flat of your hand. If you use your fingertips, you will feel all sorts of funny lumps, because actually the fat in our breast is quite lumpy, and it's difficult to determine what's actually there. If you use the flat of your hand, anything that doesn't feel right, you can feel it quite well, and you start right up here, right up in your armpit, and you go all the way around your breast. So you use your right hand for your left side, and you use your left hand for your right side, and you go all the way around, just gently feeling, and then feeling a little bit deeper with the flat of your hand all the way around your breast, right up here, under here, all the way underneath the breast. And then last of all, you feel around the nipple area, because some cancers just sit behind the nipple, just little things. And so you feel deeply around the nipple to see if you can feel any little funny lumps there. And you do that every month or so, and you will start to recognize what is normal and what isn't. You can do it like sitting up or lying down, and very often if you lie down, things may feel a little bit different. So it's probably wise to do it in both positions. And sometimes some ladies find it easier in the shower, some ladies find it easier in the bath, because when they're relaxed, then everything is easier to feel. So you just need to get yourself into a rhythm. It just needs to become normal, because as I say, when things are normal, it feels normal. And as soon as you feel something that's not normal, you think, oh, hang on a minute, this wasn't here last month. Maybe I need to do something about it. So that's what you're doing. You're basically just checking yourself so you can feel what shouldn't be there.
Lovely. Thank you very much. Now, I'm just wondering, for those ladies who have body image issues and who don't like to look at themselves in the mirror, what would you like to say to them, and how do they overcome that?
What can I say about that, except that actually each person is beautiful, regardless of what you feel about yourself. Actually, it's an important thing, and it's about caring for yourself. And maybe it is about asking God to help you start caring and loving yourself, because I think every single woman, because the way our culture is about having to be beautiful and having to be perfect, I think most women will have some sort of physical hang-up somewhere along their line at some point in their life. And it's about learning to just start being happy with yourself as ever you are. So, yes, you need to do it. Just need to do it.
You just need to do it. Thank you very much for that. Now, let's say you notice, so someone has been doing this self-examination for some time.
Yeah.
And suddenly notice, or they can feel something quite unusual. What do they have to do next?
Okay, so if they feel something unusual, then they probably need to contact their doctor or go to the clinic, the local clinic, where whatever your medical facility is, wherever you're living. So I would say in the UK, if you go and see your doctor, or certainly contact your doctor, then if you find a lump, then you'll often be referred to the 2-week wait, or the one-stop clinic at the hospital, where you will be assessed by the breast surgeons. But it will be different in different countries how things happen. But essentially, you need to have a low threshold for going to see somebody. Generally, of all the lumps you'll feel, probably only about 1 in 10 is actually something nasty. But it's always wise to get them checked out, because you just don't know. And until you've been assessed and somebody's checked for you, you're not going to know. And so you need to go and see a doctor, and they will say whether you need to go and see a surgeon or not. So that's essentially the starting point. And you will then probably not necessarily have to have the lump out, but we'll have to have special investigations like a scan or a mammogram, depending on your age, maybe have both. And that's to start with anyway. Yeah, don't put it off.
Thank you. That's a very important message.
Don't put it off.
Don't put it
Sooner
off.
it's sorted, the better.
Yeah, thank you. So, Dr. Ali, someone has just heard that news that they have cancer and they have to undergo treatment. Is there a way they have to prepare themselves to the treatment and to living with the condition? Could you just talk us through, as Christians, how we can prepare ourselves for treatment as well as living with it?
So, starting with, there is no one-size-all-fits treatment for everyone in regards to breast cancer. It all depends on the stage of the cancer. And so we have stage 1 to 4, 1 being the least and 4 being the highest. So this is a discussion you will have to have with who we call a cancer doctor, an oncologist. And they would, before they even get to that point, they would have done stuff like a biopsy. Because even whenever you find something on a mammogram, and they're not sure, is this, does it look cancerous, or not sure, they have to biopsy it. So cancers, like I said, cancers, there are different genetic makeup of cancers. So depending on what your biopsy shows is that, and the spread and the stage, then you would have that discussion as to what are your options for treatment. The most common general terms for treatment wise are you either have, if it's just a small section, either the lump itself taking out, um, you'll be offered stuff like chemotherapy or even radiation therapy. Some people, depending on the stage, as Dr. Johnson had mentioned, the lady went ahead to have, she didn't have it, but she had a risk of having it, would go ahead and have their both breasts taking out. So there are different ways of treatment. And like I said, all this has to be in coordination with your cancer doctor. And so he or she would make that decision based on what they see and the findings and the general knowledge about that type of cancer. Now, as believers, God has offered us, we're living in a falling world, right?
Yeah.
So God has put knowledge in place for us to deal with illnesses and sickness. So there's so many advances, and I said all knowledge is this knowledge has been given by God because it is for our health, right? So as a believer, whenever you are faced with such, it's a heavy diagnosis. The word cancer is very frightful to many people. They hear that and their heart just sinks. But God has given people knowledge to be able to help you through the various stages of it. So while you are praying and while you are fasting, while you are seeking God's intervention, we always still encourage you to also do the right thing medically. While God is working, then let medicine also have its role to also assist. So like I said, chemotherapy, radiation, mastectomy, lumpectomy, all those are the options that have been afforded, or the knowledge God has given to help doctors help you to live a better life. Now, when it comes to living with breast cancer or even post breast cancer, so people would have these procedures done and they would tell them, look, okay, you are in remission. Basically, at that point in time, there is no detectable sign of cancer in your system. So that's when the doctors say, oh, you are in remission at this time. Some people undergo mastectomies, and for a woman, sometimes that can be pretty traumatic, having both breasts taken out. There are options to have reconstructive surgery on both breasts, but not everyone can afford that because it is pretty pricey. So some people would have a mastectomy and they have this, there has to be a lot of psychological support that goes into that. Because as part of women, of course, we are so women, we grow up with very conscious of our body makeup. So here you are post mastectomy and you have all these changes and your mind starts to do a lot of things regarding your feelings as a woman, your confidence, it starts to affect every area of your life. Some people start to get depressed over the changes that have taken place. So there has to be a lot of support, both from the families, if you're married, from a spouse, it has to be a support from, people around you, communities. There are a lot of psychological help centers for women dealing with cancer, that if depending on where you are, it is always a good idea. I always encourage people, there's something powerful about what we call group therapy. So when you're dealing with something, to have a community of people that are dealing with it, because there's so much information I can give you or help if I haven't been through something. But if I'm dealing with something and you are dealing with, there's a shared bond that I can say, look, I've dealt with this and this is how I went through it. So trying to find in your local community, even if there's none, you can actually start one, to
Yeah.
say, hey, I'm dealing with this and I think I need support. I think I need some emotional help. I need people that are going through the same thing so that we can help each other through whatever process. Because like we know, chemo, most of the available options, chemo is hard. Chemo is hard on the body itself. So when people are dealing with all this, they need that support. So you can live a normal life, post breast cancer, but there are certain things that have to come in place depending on what was done for you treatment wise. So like I said, you always want to have a very good discussion with your oncologist and know what's available for you treatment-wise, and to know the various resources that are available in terms of a support and counseling, and just as believers, we know that our bedrock is prayer. Our bedrock is the word of God. So that has to be a foundation first for anything, while or you're not here by yourself. God has surrounded you with human beings. So you can't be an island dealing with it by yourself. So always find a way to reach out to people around you just to ask for some psychological support. Can you hear me?
I can hear you.
Okay.
Are you okay?
Did you hear the last thing I said? Okay, yes. So I said you always have to find whatever is available to you in terms of support so that you can live, like I said, you can live a normal life post a cancer diagnosis. You just have to know what's available to you treatment-wise, and you have to be able to gather enough resources to be able to cope with the illness depending on what intervention was done.
Thank you very much for that. I love the fact that you talked about support groups, because sometimes we tend to be very secretive, and especially when we are going through such dark patches, we like to keep to ourselves and just feel very isolated. So like you said, if there's no support group out there, maybe you should start one and actually get people together. And then you could even use that to pray as well as you do the treatment. So thank you very much for that. Dr. Jonathan Lai, now, how do we prevent this as much as we possibly can? How do we prevent ourselves from having breast cancer?
Okay, so I'll probably start off by just saying a couple of things about what Dr. Ali said, and then I'll come to that. You know, we are talking about preventive health, right?
Yes.
And part of that is what Dr. Kate was talking about. Um, Knowing your body, so that if you recognize something different, then you can get that checked out. And I think that's very important. In a lot of instances, especially in developing countries, a lot of times you see women that come in with like very advanced disease. Like they come in when the breast is, almost rotten and they're smelling and it's bleeding. So, sometimes they get shunned and all that. I mean, part of it may be related to not having money. However, I think the important thing that we're talking about here is that if you check yourself, you know how your breasts feel, then when there are changes, then you can go get checked out. And the sooner you can get checked out, the better it is. Now, the big important thing here is that, as Dr. Ali said, there are different stages. So we talk about stage 1, stage 2, stage 3, and stage 4. Usually when we talk about any cancer, stage 4 means that it has spread outside of where it started, right? And typically, the earlier the stage, so if it's stage 1, majority of patients do very well. They get treated, they get cured. If it's stage 4, then not so good in terms of the outcomes. And so it's very important to understand that, being like showing up early is important to your survival, because the survival is better if it's an early stage. So I think those are very important points to note. The second thing I would say is that, again, in a lot of developing countries, you see people peddling uh, herbal medications that they purport treat cancer. So I want to categorically state that there is no proven herbal medication to treat cancer or to cure cancer. Yes, some of the herbal medications may have a role to play, but not for curing cancer. Cancer is not something that you need to play with. It's, again, you ask the question, is it a death sentence, right? In general, it's not. However, depending on how you manage it, it can become a death sentence because the longer you wait before you start getting care, then it will be at a later stage, and then it may become a death sentence. So I want to make those points that it's very important that yes, as Dr. Patience said, majority of lumps in the breast are not going to be cancer. However, you don't know the difference until you get checked out. And so that's one of the important points. So we are talking about how do we prevent it, right?
Yeah.
So by knowing our bodies and then making sure that when there are changes, we can go get checked out. Okay. The other thing is in developed countries, we do what we call screening. Okay. So screening is where you don't have any symptoms, you don't have any lumps, but you are getting checked to make sure that you don't have cancer or to make sure that you don't have any changes that are early signs before even a lump develops. So in most developed countries, the primary way of doing the screening is with what we call a mammogram, which is a special X-ray of the breast, and it's able to show, changes that are sometimes very tiny, that you will not feel. And then if those changes are there, they can be, biopsy or a sample of that area can be taken to make sure that it's not breast cancer. Okay, so so screening, if it's available, it's important. Now, again, I know a lot of our listeners are in countries where they don't have, a screening program, or they don't have mammography, or even if they have, it's only the rich people who can afford to get it done. However, if you can understand your body and like Dr. Kate was saying, doing like monthly, you check your breast. If there are changes, you can know and you can get that checked out. So that's one. And so as we talked about, so preventing it in the first place is kind of doing screening or making sure that when you have lumps or changes, you get them checked out. Okay, because some of the things that you may go and get checked up with maybe precancerous conditions, so they can be taken care of before they even develop cancer, or even if it's cancer, you can catch it at an early stage. So those are important things. And the other thing, about preventing it is one thing that Dr. Kate kind of mentioned. If at all it's within your control, kind of having your children early and breastfeeding, right? That decreases your risk of getting breast cancer as well. She mentioned smoking. So smoking, alcohol intake, those things are associated with a higher risk. So those are the risk factors that you can control, and then also obesity, as she mentioned. So making sure that we have a healthy weight, as we talked about the last time, and exercise, to make sure that we decrease risk of developing breast cancer. So those are some of the ways of preventing it. Now, I also talked about the example of Angelina Jolie, right? So she knew that she had the BRCA gene mutation. So for her to prevent breast cancer, she got her breast removed, right? I know several people who have done that, because it's a preventive, strategy. Now, if you know your risk factor, for example, if you know that you have that gene mutation, there are other things like, going on some hormonal therapy, to decrease your risk, is there. But again, I think the important thing is that, a lot of these things you are not going to know on your own. And so if there is something, something different about your body, you need to get that checked out. And then if you know that you have the mutations that we're talking, the genetic changes like the BRCA gene mutation, or you have, a lot of members of a lot of women in your family who have had breast cancer, then you need to get checked to make sure that if you have that mutation, then you can be counseled as to what you can do to prevent yourself from getting breast cancer.
Thank you very much for that. Now, moving on swiftly, Dr. Patience Anand, what is cervical cancer and where does it occur?
So cervical cancer is a cancer that happens in the opening of the womb. So when you look inside the vagina, there's a lining of the womb, and that lining is where cancer occurs. It's called the cervix, and that's inside your vagina. So that's what cervical cancer is.
Right. And what are some of the symptoms that are associated with cervical cancer, Dr. Anand?
So cervical cancer is associated, the main symptom really is abnormal vaginal bleeding, which normally happens. So every woman has, a cycle. You know the times that you bleed, and you know how long your cycle is. So if you start getting bleeding outside that cycle, then it's an alarm bell, something that you need to start getting concerned about. So you can find that some women will start having bleeding in between their periods, which is not normal. It could be the bleeding could be heavy, or it could be like a very light trickles of bleeding that will last maybe a day or two. But if it's something that you can see that is persistent and is not stopping, then you need to get worried. Also, some women can also have bleeding during sex. That's not a normal thing that should happen. So if you notice that you're having bleeding during, sexual intercourse or after you've had sex, then it's something that you need to start, thinking about getting checked out. So those are the symptoms of cervical cancer. That's the main symptom of cervical cancer.
Thank you very much for that. Now, Ali, what are the risk factors, please? What are the risk factors and the causes of cervical cancer?
So, in cervical cancer is one of those cancers that actually has a virus that has been associated with it. It's called the human papilloma virus. There are different strains of it. Not all strains have a strong cancer potential, but infection with, oh God, the HPV virus is actually one of the main causes and risk factors for cervical cancer. And it is a virus that is typically spread through sexual activity. It is the main risk factor for that. So we're looking at sex at if you start having sex at an earlier age, you are at increased risk of having the HPV virus. For people that have a weakened immune system. So the HPV virus is actually a pretty common virus. About 80% of folks would have it, but sometimes it can go on its own, but not everyone. There are changes. So it causes changes in your cervix, which, if not detected on time, can lead you to have cervical cancer. So other things that might increase your risk for it are actually what we call chlamydia infections, which is a STD. So and chlamydia is one of those infections that can stay really quiet, and you won't even know that you're having any symptoms with it. So we always advise, screening for that. Multiple sexual partners can increase your risk for having HPV. Smoking. Smoking can increase your risk for cervical cancer. Like we said, smoking pretty much when it comes to most cancers, smoking is a big culprit for that. So smoking can increase your risk for that. Oral contraceptives can also do that, also increase your risk for cervical cancer. And, the other funny thing that which for some cancers is protective, but for cervical cancer not, is actually multiple pregnancies can also increase your risk for cervical cancer. So those are, like I said, the HPV virus plays a huge central role in cervical cancer. So that is typically what is screened for a lot of times whenever you're doing whenever you're trying to look for the risk factors for cervical cancer.
Thank you very much for that. Dr. Kate, so how is there anything like self-examination when it comes to cervical cancer? Then can you talk us through the diagnosis, please?
So no, there's not really any self-examination, except as Dr. Patience has said, it's important that you recognise the symptoms. I'm getting some feedback. Is that okay?
Yeah.
So it's important that you recognise the symptoms, as Dr. Patience has said, but actually there's no real self-examination because your cervix is hidden right inside of you. If you have a coil or something like that, for contraception, you will probably be used to just checking to see if your strings are there, and that funny little knobbly feeling like the end of your nose that you feel is what the cervix feels like. And I suppose that can feel funny or hard or knobbly or different, craggy if you've got a cancer there, but it's not something you would necessarily do regularly. But actually going for a cervical smear or a pap smear on a regular basis is a very good thing to do. So that starts generally in your mid-20s in the UK and continues up until 65 and is done every 3 years unless there have been some abnormalities. And essentially going for your smear can prevent you dying from cervical cancer, because actually cancer of the cervix very often doesn't show itself. So you can feel absolutely fine, get no bleeding, have no bleeding after sex, have no bleeding between your periods, and yet still have cervical cancer. So the only way very often that you can tell is to go for your regular cervical or pap smears. So I don't know the system in different countries, but certainly in the UK, it's generally the practice nurse that will do them. And they're usually very friendly. They do lots, so they get used to it. And I, for myself, whenever I see patients, I rarely remember what their bits look like. I usually remember their faces and whether we had a good conversation or not. I very rarely remember what's wrong with them, and I even less rarely remember whether I did a smear or something like that. So I think you need to get over the embarrassment, because it's really important to get this done. But it is really embarrassing for lots of women, because you're making yourself very vulnerable, very exposed. The way the nurse will do it is they will ask you just to lie flat on the couch, bring up your knees, and then they will put in a speculum into your vagina, and that will show them the cervix. And then they will use a brush and they will just sweep it round your cervix about 5 times. And they will put that brush into a little pot of fluid, and that goes off to the lab. And then 2 or 3 weeks later, you get a result through. Then depending on what the result is, if it's clear, you'll say clear, don't need to see you for 3 years. Or if it's abnormal, then you will often be asked to go to something called a colposcopy clinic, which is a gynecologist or a female bits doctor, essentially. They usually have a clinic where it's set up so they can just look at the neck of your womb, and they will examine it, often put a dye on it to see if there are any abnormal cells, and maybe again take a biopsy. So it's usually undignified, it's usually mildly embarrassing, possibly sometimes slightly uncomfortable, but it can save your life. So what is the point about getting hung up about embarrassment if actually this procedure can save your life? And I do know of women who have died under 30 from cervical cancer. So it's really important to get it done, because actually at that age, you will often be leaving small children, and you don't want to do that to your families. You just don't want to do that. A bit of embarrassment is just worth nothing compared to leaving your children motherless. And that it's a reality, I'm afraid. It's not It's not just the scaremonger thing. It's really important you get your smears done.
Thank you very much. Thank you very much for that.
Can I add something to what?
Yes, please, Dr. Lai.
So I think the other thing about prevention is that there's a vaccine for the HPV virus.
Yeah.
Okay. So and this vaccine is given to young children even before, when they are even pre-teens, to protect them. Unfortunately, when this vaccine has been around for a few years now, but there is some notion, especially from some Christian groups, that they think that, oh, I don't want my daughters or my sons to be vaccinated because it's going to make them sexually promiscuous. No, this is really protection against a virus that is very, very common. The HPV virus, as Dr. Ali said, is very, very common. Not all of them, not all there are different strains, and not all of them will predispose to cancer. Some of them will predispose to what we call warts, which are some growths that may happen around the genital areas and the anal areas. And then some of them predispose to cancer. And there are, these vaccines that have been developed to help to prevent, these infections, which can lead to cervical cancer. So that's very important to stress.
Yeah.
Thank you very much for that, Dr. Lai. So a few days ago, my older girls were asking me when they were next due for a vaccination. And so we actually spoke about this. And I find it really exciting for you to have addressed that issue, especially amongst Christians. So that's a very important vaccine we need to get our preteen or teenage girls to have.
So, sorry,
go on.
Maud, in the UK, they've just started rolling out the HPV vaccine from September last year. I think it's year 8, girls aged 12 and 13. So they will be doing that for all girls between the age of 12 and 13. So that as of last September. So it is part of the vaccination program.
Yeah,
in the UK now.
Yeah, lovely. Thank you. Dr. Anand, what are some of the interesting things you've heard with regards to this HPV vaccination? Have you heard any interesting, like people talk about it in very interesting way, especially from the ethnic minority, like with regards to their...
Not particularly. I mean, from the people that I've spoken to, people seem to be quite, accepting of the fact that like children to have it. But it's probably because I live, we're here in the UK, so people are more informed about the uses of the reasons why their children are getting the vaccine. What I'd like to stress is that it's important, it's a good thing. And even, beyond teenage age, if you haven't had that vaccine and, you know that, you're sexually active and might be at risk, it's something that is good to go and have, for prevention. And like what Dr. Kate was saying, go for your smear test, go and have your smear done and get yourself checked out. But what I wanted to add is that I stressed it when I was talking about symptoms, is post-menopausal bleeding is also a very crucial, important symptom to be aware of. So if you've gone on your menopause and you start bleeding, it's an urgent urgent problem here. Here in the UK, if you go to your doctor and you say that you're getting postmenopausal bleeding, then you're basically going to be put on the 2-week waiting list where you go and get urgent checks to make sure that it's not cancer, because bleeding after your menopause is not normal. And then if you're looking at advanced cervical cancer, like what Dr. Kate said, sometimes you can go without any symptoms. You might not have any bleeding, you might not have any pain during sex or bleeding during sex, and then it can still turn out that you still have, you've had, this cervical cancer growing in you advanced. So some of the symptoms that you can get is, lower abdominal pain or lower back pain, which is constant. So pain in the pelvis is not normal. If you're getting constant pelvic pain, go and get yourself checked out. Constipation. So if you find that your bowel habit has changed, if you're somebody who was going regularly, all of a sudden you're struggling to go to the toilet, go again and get yourself checked out. So if you find that you're losing control of, urine, passing urine, or going to the toilet to your bowel movements, go and get checked out as well, because that's not normal. So anything that you see that is out of your normal, bodily activity is something that is a cause for concern, and you need to go and have it checked out.
Yeah.
Yeah.
Yeah, thank you. So I have this interesting someone from Facebook Live is just talking, and she's just saying that a few years or a couple of years ago, she refused to allow her 13-year-old daughter to have the vaccine out of the fear of it. So Dr. Jonathan Lai, thank you so much for highlighting on that. And yeah, she's now it's definitely not something she will do because she knows better now. Dr. Arnie, could you please talk us through the living with the condition? What do you have to do when you have to go through treatment and you are living with it? What do you do? Is it the same as for breast cancer, or is slightly different?
Well, so it also depends on, like we talked about, cancer is all about staging, right? Cancer, depending on the severity, would put it into stages. So it is always a good idea to, like I said, once you get to the stage of cervical cancer, at that time, you're already seeing a gynecologist. So you're already seeing a doctor that deals with female issues. And so they would give you the various options. For some people, depending on the spread, at that time, they're offered a hysterectomy. So pretty much taking out the uterus, your cervix, and all that, just to deal with the cancer. And some people are offered chemo. So you have all those options which you have to discuss with your oncologist. Um, and for some people, especially if this is a young female, and you're telling her she has a diagnosis of cervical cancer, and then you're saying, okay, we have to take, and she's looking to get pregnant, she wants to have kids down the line, then it becomes a very sensitive issue. It's easy to say, let's take out your uterus when you don't think you want to have kids anymore, right? But then when you still have that hope and longing, and here you are faced with a decision as to, is this, we need to take this out, so then it becomes a very dicey situation, which you have to work closely with your doctor. Now, there are some, doctors that can do some radical therapy in terms of preserving your uterus. But like I said, it's all based on the individual. So that you have to just find out from your cancer doctor, your oncologist, what category you fall into. And for the most part, because cervical cancer is one that is detected pretty early in a lot of people, once they have their uterus taken out down the line, they don't have any, you have to have, of course, yearly visits with your oncologist or your female doctor, and you still have to have those tests done. So even if you've had, so this is one thing what I talk about, even if you've had what called a hysterectomy, you've had your cervix, you've had your uterus taken out, you still need to get checked. Now, for cervical cancer now, not for any other reason. Because if you've had cervical cancer and had to have those taken out, you still need to have visits with your gynecologist. You still need to have pelvic exams. You still need to have that area checked, just to make sure that at some point in time they didn't miss anything in terms of the cancer and it went to hide somewhere and starts to present somewhere else. So the fact that you've had cervical cancer and had a hysterectomy, absolutely, you still need to have, those are the folks we would encourage to still go and have, well, not so much as pap tests, but to have exams, pelvic exams, vaginal exams, to take a visual look down there. Because, like we've talked about, it's not an area that most people go to look or to search. So you need someone with an experienced eye to be able to say, oh, this doesn't look right, and we need to do something different with this.
Yeah, yeah. Thank you very much for that. Is there any addition? Yeah, go on. Go on,
Um,
Doctor.
There is that stage between a normal smear and overt cancer, big lumps of cancer, as it were. There's a stage where there's changes that are starting to go on in the cervix, and you can get like a carcinoma in situ, so just changes and precancerous and cancerous changes just within the cervix that have not spread anywhere else. And in fact, that's one of the reasons for doing smears, because sometimes you can get changes and then they're precancerous, but in fact, they will then go back to normal, or they may get further, or they may go back to normal again. And so part of the smear, part of doing smears regularly is to keep an eye on that. And when it gets to a certain point, that's when the gynecologist will say, well, let's take that little area out. And they just take like a loop of that part of the cervix, and that will often just get rid of the problem. So you have this point where actually you've got a relatively minor procedure curing you of something that could become very become like you need your hysterectomy, you need your womb out. So that's another reason why it's good to get these things sorted out early, because something minor like just a loop resection can just a small amount being taken away of the cervix doesn't stop you having children and may prevent you needing a hysterectomy. So it's another reason for going early, because minor changes can still be healed and cured.
Thank you for answering those two questions in there.
Let me add a little bit to it. I think, you know, the other issue is that, you know, that so the treatments, as have been mentioned, you know, so surgery, that is doing the hysterectomy, removing the uterus, is one. The other options are radiation and chemo, okay, as well as, you know, these days we talk about immunotherapy as well. Now, Dr. Ali was talking about the fact that sometimes your younger patients may have reservations about surgery because they want to have children, right? Now, you know, surgery is typically for early stage cervical cancer. Now, at a certain point, it's not curable by surgery, and that's where the chemo and radiation will be given. Now, so even when you are not having the hysterectomy, the radiation is actually going to affect your ability to have kids. So again, it's not kind of an either or. That's why it's very important, as has been said, that getting your pap smears is critically important, because if there are changes which are precancerous, they can be taken care of. Dr. Kate mentioned the loop procedure. There are laser procedures that can be done. There are, you know, other procedures where we call, you know, conization, where you remove a portion of the cervix to take care of this and prevent you from developing cancer. And so, once again, I think the importance of prevention is very important. Unfortunately, in the developing countries, a lot of women die from cervical cancer. I mean, it's staggering if you look at the number of young women who die from cervical cancer because they don't have access to these screening modalities.
Thank you very much for that. I have a question. So the question is, if you are at risk or if you are predisposed to what, does that make you at risk of getting cervical cancer?
Well, so if you have warts, then it's kind of a yes and no. You know, the important thing is if you have warts, they need to be removed.
Okay.
And in the US, for example, once we remove warts and we send them to the lab, they will, you know, they will check the HPV type, right? So as we mentioned before, there are some types of HPV virus that do not cause cancer. And so sometimes they may just be the HPV type that causes warts, right? So in that sense, you may not be at risk of developing cancer if you don't engage in high risk behaviors, as Dr. Ali previously mentioned, like, being promiscuous, having multiple sexual partners, and things like that. So, um, so again, it's once we know what type of HPV you have, that kind of tells us, what your risk of developing, cancer is if you have warts.
Thank you very much. I hope the viewer is happy with the answer. If not, just ask another question and they're more than happy to give you an answer. Dr. Loyi, now over to your favorite subject. What is colorectal surgery? Or what is,
Or
colorectal cancer? And then
okay,
we'll talk
so for the purpose of this, I will just use the term colon cancer to refer to both. Okay. So when we talk about the colon, okay, well, let's talk about the intestines. Okay. So there are two parts of the intestines. We have the small intestines and we have the large intestine. So the large intestine is called the colon. Okay. The small intestines, typically, their job is to help with absorption of nutrients. So when you eat, the stomach will digest the food and then it goes through the large intestines, which is about 40 feet long. And as it goes through, the nutrients are absorbed. The function of the large intestine or the colon is really to absorb fluid and then, pass along the stool. Okay. And so when we talk about cancer, colorectal, so the colon kind of ends at the bottom in the rectum. So, since it's one continuous organ, we say colorectal cancer. But let me just use the term colon cancer so that it'll be simple. So when we talk about colon cancer, it is cancer that is developing in the large intestine. Okay, so again, we talked earlier on about the fact that, the normal cells kind of become abnormal and then they kind of grow and go rogue. Now, in terms of colon cancer, majority of the time, okay, individuals, we form growths on the inner lining of the colon, right? They are called polyps. So for majority of the time, polyps, these are growths that happen in the lining, and then if they keep growing and they are not removed, then they can turn into cancer. Okay, so majority of the time these start as polyps, and then they transform into cancer if they are not removed. And as we go along, we will talk about why it's, in certain parts, it's important to do screening, because when you do screening, you are removing these polyps before they can become cancer. Now, just to give a little bit of kind of perspective, okay, if you look, how frequent colon cancer is depends on where you live. Okay, so for example, in the United States, in men and in women, colon cancer is the second most common cancer. So in men, prostate cancer tends to be the kind of most common. Well, I would say we have lung cancer, prostate cancer, and then colon cancer, right? In women, you get breast cancer, lung cancer, and then colon cancer. So it is the third most common cancer in both men and women in the United States. Now, when you look at deaths from cancer, it's still the number 3 cause of cancer in men and in women. Now, if you put men and women together in the United States, colon cancer is the second leading cause of deaths from cancer in the United States. Now, in some developing countries, colon cancer is not very prevalent. It doesn't mean that it doesn't exist. It's just because, you know, they have more infectious diseases. And as countries develop and they kind of get over the infectious diseases, you begin to see what we call non-communicable diseases. So like high blood pressure, diabetes, heart disease, cancers. So these are increasing because now, you know, people are living longer from the fact that, you know, previously a lot of people were dying from different infections and stuff. So they were not living long enough to even develop these cancers. And as we get rid of a lot of the infections, we are going to start seeing a lot more of these, you know, cancers. Now, when we talk about colon cancer, as has been said, and the theme is the same. Majority of people with cancer don't have any symptoms.
Okay.
That is the scary part of it. That for colon cancer, majority of patients will have no symptoms. A lot of times it is found incidentally, like, you know, it is found maybe they had a kidney stone and they had a scan for that and then it shows up on it, or they had a screening. And I think there's a very important thing that I wanted to say here. The last time we did this segment, I think it was Pastor Paul talked about a bishop
Yeah.
in the Anglican Church where he was forced to go do blood work or to see his GP because they were not going to pay him if he didn't do that. They were forcing them to get checkup. And then when he went, they found out that he was anemic. And then when they did investigations, they found he had colon cancer and it was early stage. So again, majority of people will have no symptoms. And so that is why in places where colon cancer is very prevalent, like in the US, it's important to do screening. But we'll also talk about kind of red flags that you need to look at. I'm sure we'll talk about that a little later.
Thank you very much for that. That was pretty awesome. Dr. Anand, what are some of the symptoms? I think Dr. Lai touched a bit on that, but what are some of the symptoms of colon cancer?
So, like what Dr. Lai said, most cases, there's no particular symptoms. It's colon cancer is usually detected through screening or incidentally. But some things that you can look out for is things like change in your bowel habits. So every person has a pattern that you have for your bowel, movement. So once you notice that that's changed, so either it's become a bit more loose, so you need to look at the consistency of your bowel movement. Is it not formed? If it was previously coming out formed, does it become more loose? I know it's not a very, nice subject to talk about, but it's like be a bit sort of not paranoid, but a bit more pay attention to detail, like we do with our children. If your children is going to the toilet, you're concerned to see whether they're constipated, do they have diarrhea. So that's the same thing with yourself. Look at the consistency of your motion. Is it are you going to the toilet more often than normal? Are you having diarrhea? And sometimes what happens is with bowel cancer is that you have like an interchanging sort of bowel habit. So you can become constipated where you're struggling to go, and then all of a sudden you start having loose bowel motion. So you're having like a diarrhea kind of bowel movement. So when you start seeing things like that, that's a telltale sign that something is not quite right. The other thing as well is seeing blood in your bowel movement. That's not normal. Now, blood doesn't necessarily mean that you've got cancer, because there are other conditions in the bowel, then that can also give you, blood, in your bowel movement, stool. So things like that are like things like piles, which is quite common, hemorrhoids. But here in the UK, our rule of thumb is that once you see blood in your bowel movement, go and have it checked out. Whether you have piles or not, just let your physician go and have a look at, and see that, everything is okay. There's nothing to worry about. So that is very important. If you're seeing blood in your stool, when you go to the toilet, definitely go to your doctor and ask them to, do a health screen. The other thing as well that you might have is abdominal pain. Some people get bloating, and usually when you start getting those kind of symptoms, your bowel cancer is advancing. When you start getting things like, bloating, you're getting abdominal pain. Some people lose weight. You get, weight loss where you're not actually trying to lose weight, but you're just losing weight. Some people develop, a loss of appetite, so you don't feel like eating, and once it's quite advanced, you find that patients present with obstruction, what we call bowel obstruction. So everything that they're eating cannot descend down their colon. So some of them, they come in with nausea and vomiting, so they're vomiting because their bowel is blocked. So those are the kind of things that you need to look out for. So if you start having anything that is out of the ordinary, then you need to start, paying more attention and, just go to your doctor and get the checkup.
Thank you very much for that. Dr. Ali, could you just talk us through the diagnosis of colon cancer? What do you go through when you're having a diagnosis?
So for now, the hallmark of diagnosis for colon cancer is a colonoscopy. Basically, what that involves is taking like a small camera through a wire and going through your bottom, and looking through your entire large intestine, your bowels, you know. And by that, when they're looking, they can visibly see, like what Dr. Jonathan said, polyps, and when they see a polyp, they can then cut it out or take a biopsy of it, because not all polyps are cancerous. You can have polyps, but they're really not cancerous. They're just more of like an overgrowth.
Hmm.
So colonoscopy is still pretty much from a diagnosis standpoint, the hallmark of diagnosing colon cancer. There are other things that, you can use, what we call screening methods. So these are more of screening, not diagnosing, because those are two different things. When you already have a problem, then they're trying to diagnose you. Screening is offered when, you feel
Don't know.
okay.
Yeah.
You just don't know it. You get to a certain age and it's been said, okay, at this age, people at this age have a certain predisposition. So like here in the States, you would typically offer once you hit 50, is the time that you start to offer screenings to say, okay, you would need to have a colonoscopy, either that or here you need to have, or you can actually send what we call a stool sample. And they look at that stool sample and they can test to see are there traces of blood, not blood that you can see, but something that can be picked up from microscope to say, okay, is there blood here? However, the thing is, if those two tests come back abnormal, it's still not confirmatory. So you would still have to end up having a colonoscopy to actually look to say, okay, something is abnormal here. What exactly is it? And then you will get a biopsy of it. And based on the findings on the biopsy, will determine are you dealing with actual colon cancer or is there some other changes going on in your colon?
Thank you very much for that. Dr. Lai, could you just talk us through treatments, please, and living with the condition?
So the other aspect of diagnosis is sometimes, some people for one reason or another may not be able to undergo a colonoscopy, or it may not be available. And so there is also a test that we call a barium enema. So this is where they put some dye from the bottom into the colon and take x-rays and that can show if there's a mass or a tumor or growth, to put it that way, in the colon. Now, once a diagnosis has been made, again, as with all the other cancers, we have to do what we call staging, okay, because the treatment is going to be based on the stage. So staging is where we are doing scans to look for evidence of spread. Okay, so colon cancer, if it's going to spread, the most common location that is going to spread to is the liver. Okay, then the next most common spot that it will spread to is the lungs. So we would do a CT scan of the chest and of the abdomen, okay, looking for evidence of spread, okay. Now, if it hasn't spread, then that means it is not stage 4. So we talked about the 4 stages of cancer, right? So stage 4 means it has spread. So if it's not spread, then it could be stage 1, 2, or 3, okay. So now the next step for colon cancer is then, to make sure that we are getting, the patient ready for surgery. Okay, so we go in and remove a segment of the large intestine. Okay, most of the time, depending on the conditions, we can reattach the colon together once we remove that segment. So we remove it with all the blood vessels to that area and all the lymph nodes that are in that segment. Okay, and then the pathologist then will look at it under the microscope and look at how many lymph nodes. So lymph nodes are these little structures that filter out kind of the blood. So in general, they serve as kind of, if I would say, army barracks, where they filter out um, infectious agents like bacteria, viruses. They filter out cancer cells and actually destroy them before they get around. But when the cancer has already developed and become advanced, then the cancer may go into the lymph nodes, and that goes into part of the staging when we say what stage is it. Okay, so we do surgery, and then once after the surgery, then we decide based on the pathology, is it stage 1, 2, or 3, right? So if it's stage 1, then typically surgery is all you need. If you take 100 people with stage 1 colon cancer, after surgery, if you look 5 years later, 95 of them will still be alive. And so if it's stage 1, the survival is very good. Now, if it's stage 2, for most people, stage 2 is also surgery alone, but some stage 2 patients may require chemotherapy. Now, if it's stage 3, definitely they will require chemotherapy. Interestingly, for stage 4, colon cancer is one of the few cancers where even some stage 4s can be cured. Majority of cancers, stage 4 cannot be cured, but some stage 4 colon cancers can be cured. So we remove the tumor, they get chemotherapy, and sometimes we remove part of the liver. And if onto the lung, sometimes we remove part of the lung as well. And then, so I've talked about chemotherapy, surgery, and then these days we have immunotherapy as well, for some patients. Now, when it comes to rectal cancer, that is the bottom aspect of the large intestine. In addition to all that I've mentioned, there is also radiation. So we don't give radiation for colon cancer, we give radiation for rectal, cancer, in addition to the surgery and the chemotherapy.
Awesome. Thank you very much for that. Dr. Kate Forbes, do you want to talk us through some red flags generally? When should we start getting worried about with regards to breast cancer? Let's look at breast cancer first. What are the red flags?
Shall I talk about the general red flags generally for cancer or specifically?
I think let's do it general because we are out of time actually. Yeah.
Okay. So essentially, any swelling that shouldn't be there, any discharge, any bloody discharge, or blood coming from anywhere in the body that shouldn't be there,
Mm.
any unexpected weight loss, any unexpected tiredness, any unexpected functions of your body. So, as Dr. Patient said, the change in bowel habit, discharge from one side of your breast, so just one breast. If you get a blood or a discharge, that's usually a sign. So basically, bleeding when you shouldn't have it, weight loss when you shouldn't have it, change of function of any part of your body when you're not expecting it, tiredness when you're not expecting it. So things like you wouldn't expect to have a cough all the time. You wouldn't expect to lose weight for no reason except if you're on a diet. You wouldn't expect to get bleeding from your bottom. You wouldn't expect to get bleeding from your vagina between your periods. All those sort of things. It's basically anything your body doesn't normally do that it starts to do. Any weight loss, any blood that shouldn't be there, essentially. And that's sort of very broad and very basic, but you know, they're the sort of things that we can remember. Do I normally do that? No. Have I lost weight? Yes. And you know, should I be having this bleeding? No. And also the other thing is pain where you don't normally have it.
Okay.
Yeah, that's the other thing. Essentially, yes, there you go.
Thank you very much, Dr.
I'm afraid a very broad sweep, but
Yeah, yeah. We are actually running out of time now. Dr. Ali, could you quickly go through with us what are some of the myths? What are some of the things you've heard about cancer which are not true? Could you just quickly take us through some of them?
Okay, so in terms of cancer, a lot of people wonder, is cancer contagious? Well, no, cancer is not, we talked about the HPV. Now that's the agent that causes cancer, but not the actual cancer itself being contagious. So cancer is not contagious. The other myth about cancer would be, are there herbs, Dr. addressed it,
Yeah.
are there herbs or something I can drink, that would flush out my cancer or remove it? No, that so far, there hasn't been anything that has come up in that aspect that we can say now. Is there a diet that I can be on to prevent cancer? Well, sadly not, because there are people you have discovered, and from studies, they did everything right. They ate the right foods, they did exercise, they did, all that, and they still ended up with cancer. So there is no magic diet you can be on that can prevent you from getting cancer. Sugars, some people say, oh, do high sugars cause me to have cancer? Well, there isn't a direct link to that. What high sugars tend to do is sugar feeds all your body cells, right? So if there are cancer cells there, it is still going to feed from the sugar the same way your body cells are. But of course, high sugars increase your risk if you eat a lot of sugars of becoming obese. And obesity on its own is an increased risk for getting cancer, and even as regards to the cervical cancer, well, I'm not promiscuous. I don't, I just have one partner. So chances of me getting it, well, sadly, you don't have to have had, we're talking to a group of believers, you don't have to have had a very, promiscuous lifestyle to actually develop cervical cancer, and if you have tests, you really don't have to do them every year. Like they said, it's every 3 years. So some people are just, like she said, for some people, it's a very uncomfortable process. So every 3 years is enough to pretty much screen you for cervical cancer. And I would say those are the major myths that I know, except anyone else has any question or anyone has any cancer myths that they want to dispel.
Yeah, so I have this question here that does the pap smear, does it break your virginity?
Can you hear me?
No.
Yeah, no, no, there's no documented finding that actually does that, So I'm glad they asked that question because people will come and say, they always tell us, people will say, look, you ask, you say, I'm not sexually active.
Mm.
I've never been, so why is my doctor still saying that I need to get screened for cervical cancer? So from the medical side, and I'm just going to put it, what is it? Trust but verify, right? There's that saying. Even though you have said that, don't get offended with your doctor for still insisting because people have their different reasons why they would withhold certain information from their doctor regarding that. So we will still encourage, even if you tell us that this has never happened before, based on your age and what we know about it, we would still try to encourage you to get that done.
Lovely. Thank you very much. Dr. Lahi, have you heard of any other myth that we need to talk about this evening?
I think, um, you know, one of the myths is that people think I'm young, and
Okay.
so I can't have cancer. Cancer is a disease of older people. Now, interestingly, as we have been talking about these cancers, now if you look at colon cancer, for example, in the US, over the last 20 to 30 years, the incidence has been going down. The numbers have been going down. However, if you look at patients who are younger than 50, the incidence actually has been going up over the last 20, 30 years. So we are beginning to see more and more younger people with cancer. So, in the past, so for example, as you mentioned, Chadwick Boseman, who acted in Black Panther, everybody heard he died yesterday from colon cancer. I mean, he was only 43 and he was diagnosed 4 years ago. So he was 39 when he was diagnosed. So again, the fact that you are young does not mean that you cannot develop cancer. And so, if you are, as we've talked about, if anything is not right, it's important to get checked out. Now, when it comes to bowel cancer, one of the unfortunate things is that people tend to blame a lot of bleeding piles, as Dr. Patient said, and so, people will have bleeding and then they will just blame it on piles. Um, in my practice, if you come in, I don't care how old you are, if you have bleeding, either bleeding in your stools or bleeding when you wipe, even if you have piles or hemorrhoids, you're still going to get a colonoscopy because we've picked up a lot of cancers that way. And obviously, if you get checked and you have piles or hemorrhoids and it doesn't, let's say you get some sort of babying of your piles and it doesn't stop, that in itself needs to be a red flag. You still need to go see, somebody who will check your colon and make sure that there is, nothing bad going on. So those are some of the other myths. Yeah.
Yeah, I saw a couple that I also like to just to regarding breast cancer. They mentioned the use of deodorants. Do deodorants cause breast cancer?
Yeah.
No. There has been no known link associated with deodorants and breast cancer. And the other, thing that people say is using plastic containers, in microwaves and all
Yeah.
that. People have this use that, oh, if I use a plastic container, no, there, I said these things are there. There's no known studies. Studies have not shown any link. Now there's some certain plastics that can cause, release of chemicals, but in terms of linking these to cancer, you can safely use most plastic containers in your microwave and not have to worry that down the line that you are going to come up with cancer. Or you can use your deodorant,
What
preferably
about
so
phones?
that it's not. Yes, and even phones, yes, all those have not been associated, or like I said, everything we do in science is based on studies and prevalence and what's happened. Linking this with this, there has to be some solid evidence, linking. And so far, nothing has been shown to connect a lot of these things that people say cause cancer with actual cancer. You can do everything right. You can live a solitary life. You can eat the right stuff. You can heat all your food directly on the stove. You can decide not to wear deodorant, and you can still come down with something. So there isn't, like I said, those are myths with cancer. The things that we talked about, smoking, obesity, alcohol use, those can predispose you to certain type of cancers. But at the same time, it's not an absolute. There are people that would smoke all their lives. I mean, they would be heavy smokers, right from even when they're 7 till they're 80 and never develop lung cancer. And you would see some that just smoked for a year and still end up with lung cancer. So, these things happen, and it's just as believers, we just have to have knowledge and information, and at the same time also know, that we need to be prayerful, because, and just keep on keeping our bodies. God has given us this temple, and make sure we do everything that He instructs us to do with it so that we don't open the door for the enemy to come in.
Amazing, amazing stuff. Thank you so much. Dr. Kate Forbes, I'm going to give you a few minutes to just lead us into prophetic, whether they are declarations or whatever they are. Now, what I love most about my panelists is that they are not just medical doctors, but they are Christians and they are Bible believing, tongue speaking. So this evening, you've just seen one side of them. You're going to see another side of them in a few minutes. Please.
So when I was thinking and praying about this evening and talking about cancers, one of the things I really felt was the way that cancer makes people fearful. And actually, the very name cancer makes people go, and very often the media talks about fighting cancer and all of this. And if you think you've got cancer, it can be a very devastating and life-changing diagnosis and event. The other thing is the guilt associated with it, just that sense of, have I done something? What have I done wrong? But actually, having gone through an illness recently that wasn't cancer, but made me feel extremely vulnerable and very frightened a lot of the time, I'm aware that actually fear and vulnerability is part of the human condition. And things like illnesses, cancers, whatever, they're part of the human condition. And Jesus came as a human to share in the human condition. But actually he came as Emmanuel, God with us. And when he came to be God with us, it was to walk alongside us through these situations. He came to bring healing and declare the kingdom. So he would come and declare the kingdom of God, that the kingdom of God has come near when you are healed. And there is that sense actually that regardless of how you feel, regardless of what's going on, I feel, if you feel weak, if you feel vulnerable, if you feel frightened, that actually that's not a bad place to be. And it's not a place to feel guilty about, actually, because the healing of God comes as a work of grace. Jesus came not because we deserved it, not because we've done anything right, actually quite the opposite, because we're frail humans and we need him. Essentially, we need him. And we can have all the knowledge in the world, we can have all the understanding of how things work, we can have all the investigations, we can have all the treatments, we can have all the medications in our fingertips, but the one thing that heals us is the power of God. Actually, you can do all the right things, but actually it's the power of God that brings healing. And as medics, we're just part of the picture, actually. God uses us because actually we have a heart and we have a compassion for people, but actually he just uses us to that limit. We cannot do it on our own. We are physically unable to actually make that difference without the power of God. It is him that heals us. And when he comes declaring the kingdom, bringing healing. And I just have a sense really that there are people out there who are quite scared, frightened by the thought of cancer. What if I get it? What if, what if looking for it makes me find it? And, if I ignore it, do you think it'll go away? And all of those things. And actually, one of the things I found when I was sick and felt very frightened was actually I asked God to look after me, and I asked him to show me if I needed to do anything that day. Is there anything I need to do today? Anything that I need to ask today? Do I need to speak to somebody today about this? And very often just having that dialogue with the Holy Spirit and just asking him, what next? What do I need to do next? He is our best friend, particularly when we are vulnerable, particularly when we have got no resources of our own. He is our best friend. It says in the Beatitudes, Matthew 5, God blesses those who are poor and realize their need for him, for the kingdom of heaven is theirs. And actually, when we're vulnerable and we need him, the kingdom of heaven comes close. The kingdom of heaven comes close. And as we see in the Gospels, when the kingdom of heaven comes close, then there is healing and there are miracles. When we know our need of him, then he can come close. When we say, no, don't need you, God, wherever you are, I don't need you, that is so much harder for God to actually come in his power and in his compassion and his mercy to bring his healing. We do not have to do anything to make him do that for us, except just say, I need you. Actually, I need you. We don't deserve it at all because we are just human. None of us is perfect. None of us has got it all right. As Dr. Ali said, you can have done everything right and still get cancer. You can have done everything wrong, still not get cancer. Yeah. And so, it in the end, our days are determined by God and God alone. And I'd really like to pray. Actually, if there is anybody here who does not know God, does not know Jesus, then actually look in your heart and say, I need you. Lord, I need you. Actually, I'm just a frail human being. I have the human condition, the same as anybody else. I'm frail and I'm weak, and actually I need you. Anybody here who has that sense of actually, I'm not quite sure whether there's something wrong. I'm not quite sure whether anything that's going on in my life that is not right, anything physically is not quite right, then I would encourage you to ask God. Ask him. Ask him. He knows you better than you know yourself. If there's anything he wants you to find or see, ask him to show you, because he will. He will show you. And finally, if there's anybody who needs healing, I think we should pray, actually. I think we should pray right now. Because, God can do miracles. We do not necessarily deserve it. He has covenant with us. When we read through Psalm 23, it talks about even if we walk through the valley of the shadow of the death, he is with us, and he lays the table in the presence of our enemies. That table is not just a nice party. That table is a symbol of his covenant love for us, of the covenant that he has made for us. And that covenant means that he will fight for us, even when we're wrong, even when we're frail, even when we're human, even when we don't deserve it. It means he will fight for us, and he will continue to fight for us because he loves us. So let's just pray. I think that's the best thing. Father, I really thank you for your amazing grace towards us. I thank you for your love, which knows no bounds and no limits. And I thank you that nothing can separate us from your love. that nothing we can do or say or be or anything, Father, can separate us from your love. But Father, it says in your word that when we are poor in spirit, then we have the kingdom of God. And Father, when you come close, you bring your kingdom. And when you bring your kingdom, you bring your healing. So I ask, Father, that you would bring your healing to every sick body here this evening. Every sick body, Father, I just pray you would bring your healing and your restoration. And I declare life and wholeness and healing and blessing over every single person listening this evening. Every single person, Father, I declare wholeness and healing and blessing. In Jesus' name. Amen.
Support the GWM Mission to Africa 2022. To God be the glory. The Global Wisdom Missions, GWM, is embarking on an international missions trip to East Africa and Southern Africa in 2022. The missions trip shall include the hosting of the Intermission Mission Conference, the School of Ministry, the Medical Mission, and the Clean Water Borehole Project. The programs are scheduled to be hosted in the city of Kitwe in Zambia and the city of Nairobi in Kenya. In these international mission conferences, Global Wisdom Missions will bring together thousands of pastors, leaders, and ministers of the gospel from both regions to train them in a 5-day school of ministry in the Ministers Training Seminar. Global Wisdom Missions has the vision of reaching out to young Christian leaders, ministers, and pastors with the purpose of preserving the purity and integrity of the gospel of our Lord Jesus Christ. The mission to East and Southern Africa in 2022 will be critical because it will be the first of its kind since GWM was founded in June 2020. Following the pattern of our Lord Jesus Christ of preaching, teaching, and healing, Global Wisdom Missions will undertake additional socially responsive programs to bring healing and hope to the communities struggling with poverty, sicknesses, and diseases. Considering this, GWM will travel with medical doctors and health officials from the United States of America, USA, United Kingdom, UK, and Europe, who will volunteer to offer free treatments to thousands of sick people in both regions. Additionally, the GWM will construct a clean water borehole for the selected villages in both regions where they do not have access to clean water. In view of the above projects, the Global Wisdom Missions, GWM, is asking for your financial support and donations to make these missions and projects a possibility. Find a place in your heart to give your financial and material support to this international mission and charitable projects. Your donations will lighten our burden and make our work possible. We remain eternally grateful for your ongoing support. To donate, please visit www.globalwisdommissions.com or donate via PayPal at wisdomconference3@gmail.com. Thank you.